A period of innovation meant to make Medicare more value-based has had some successes, but perhaps not as many as we might have liked. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. For most of its history, Medicare paid for healthcare in ways that encouraged more services, whether they improved health or not. Critics called it an emphasis on volume, not value. The Affordable Care Act was intended to change that, and Medicare started a number of programs to do so, including several new ones this year. Nearly a decade after passage of the ACA, is value-based payment working? The Obama administration's goal was for 90% of Medicare payments to hospitals and doctors to be tied to measures of quality by 2018. Although distancing itself from specific targets, the Trump administration has also committed to this goal. According to the Healthcare Payment Learning and Action Network, Medicare's 90% value-based goal has been achieved. That sounds like mission accomplished, but it's not as simple as that. Different programs have different notions of value. Medicare's Hospital Readmissions Reduction Program, established in 2010, penalizes hospitals that have high rates of readmissions for certain illnesses. Although hospitals can lose only up to 3% of payment, 100% of their payment is considered tied to value. The key is whether programs like this improve healthcare quality or reduce healthcare spending. The Hospital Readmissions Reduction Program has been extensively examined, with studies drawing different conclusions. Initial analyses of the program suggest it is responsible for reducing hospital readmissions, saving Medicare billions of dollars a year. But some later studies found that these reports of success were overstated, among other concerns. Some studies found that reduced hospital readmissions were associated with increased risk of death, though not all studies agree on this point. And experts disagree on the value of the program. What is clear is that the program has had a smaller impact on hospital readmissions than originally thought, perhaps reducing them by as little as 1/3 of a percentage point. Another Medicare value-based payment program is considerably more broad. The Hospital Value-Based Purchasing Program was introduced in 2011 and rewards or penalizes hospitals based on mortality, infection rates, patient experience and safety, cost, and other measures of quality, 20 in all. Typical bonuses or penalties are a fraction of 1% of a hospital's total medical payments. A study published in Health Services Research compared about 2,800 hospitals in the program with about 300 exempt from it. The study found no effect from financial incentives of the program on quality of care or patient satisfaction. But the study included data only up to 9 months after the program's start, and it may take hospitals longer to make measurable changes. It also may not. Another study, published in BMJ, looked at outcomes 2.5 years after the start of the Hospital Value-Based Purchasing Program. It found no differences in changes in mortality rates between hospitals in the program versus those exempt from it. And another study, published in Health Affairs, found no evidence that the program improved patient satisfaction up to 3 years after implementation. Medicare has achieved greater success with programs that have raised the stakes, ones that have put hospitals and healthcare organizations at greater risk of financial loss or have offered prospects for larger financial gain. One popular approach, called bundled payments, pays health providers one amount for all of the care for a certain condition within a certain period, like 90 days for hip replacement care. There is evidence that some of these programs can save money without reductions in quality, although design details matter. Another approach, accountable care organizations, also take many forms. What they have in common is that they offer healthcare organizations the chance to earn bonuses for accepting some financial risk, provided they meet a set of quality targets. Many studies of accountable care organizations, or ACOs, have found that they reduce spending with no quality degradation. So overall, is Medicare moving towards higher value? Experts agree that results have been quite a bit more modest than expected, but some emphasize that even small successes are important to future improvements. Paying for healthcare value is a popular slogan, but Medicare is still figuring out how to do it. Hey, did you enjoy this video? You might enjoy this other video on what does Medicare really cover. We'd also really appreciate it if you'd like the episode and subscribe down below. And another good way to support the show is at patreon.com/healthcaretriage. Our Surgeon Admiral Sam does, and so does our research associate Joe Sevitz, and they're cool.